Hello, hello, hello. Hey, everybody. How's it going? This is Dr. Terri MD, and it is Super Soul Sunday. So, you guys come on in. I'm super excited about the program tonight. I can't wait to bring in my guest. You guys just don't know how excited I've been about this all day. So, you guys come on in, invite your friends. We're going to have so much fun tonight talking about life in the NICU. Okay, and I have a special guest this evening. I see one person on. I'm not sure who that is, but thank you for joining. Thank you for joining. Come on in. Come on in. Everybody come on in. Invite your friends. Tonight's guest is going to be amazing. We are talking tonight about life in the NICU nursery. And I have a very, very special guest, my dear friend. Hey, Gabrielle Jones. Oh my God, I'm so glad you're here. You're going to have so much to add. Oh my God, it's so good to see you. Hey, Dr. Simpson, thanks for joining. I miss you too, Gabrielle. I can't wait to hear your commentary when my friend gets on. Hey, girl, happy Sunday. So thank you guys for joining. I know the game is on, so it means a lot that you guys are here. We're going to have our own Super Bowl conversation right here, right now. So tonight, we're going to have a special guest joining us, Dr. Alisha Thompson. She's my good friend. She's a family medicine physician in Alabama. She is very active with the March of Dimes, as am I. But the reason she's on tonight is because she is the mother to a 23-week micropreemie. You guys, a 23-week micropreemie named Langston, who we all know and love. And so I actually met her virtually at the beginning of her journey. So I'm super, super excited that she's going to be here tonight, really to help us have some real conversations about what that means. Hey, see what that means to have a micropreemie. So tag your friends, bring them on in. I can't see if Dr. Congress is on yet. If you guys, I can't see if she's on yet. Hey, Dr. KT Johnson. Yay, you guys are in the house. So I just talked to Dr. Congress. So let me see if she's on. I can't see if she's on, but we obviously need her to have this conversation tonight. So she's on. I don't see her. I don't see her. Let me see where she is. I don't see her. Oh, you're on. Okay, there you are. Hey, girl. Hey. Okay, so let me just. I can't bring you. Why can't I bring you on? Oh my gosh, I need you for this conversation. You don't have the little tag for me to bring you on like everybody else. Why don't you have that? Let me see. Oh, there you are. Yay, Dr. Congress is on. Okay, so let's wait for her to come up. Thank you, guys. Go ahead and invite your friends. Hey, Boo! Okay, yay, she's here. She's here. Okay, so Dr. Congress, we have Dr. KT Johnson on, Gabrielle Jones on, who's a mother to a micropreemie as well, and Dr. Sherry Simpson I saw. So you guys, thank you for joining us. We're going to go ahead and get started, but go ahead and invite your friends. Share, please, the link with your friends because we have some great information to share tonight. So as you guys know, I'm gonna. Oh, hey, Doctor. I see Doctor Gobert is on here too. Another Sora. Hey. Okay, great. So, you guys, as you guys know, I'm Dr. Terri MD. I'm a board-certified neonatologist, and I'm based in Dallas. And I specialize in taking care of premature babies and their families. And I like to think I give them the gift of hope. But the thing that I struggle with the most is conversations with families. And I am expecting Dr. Congress to help us with that tonight. So Dr. Congress, as I shared at the beginning, is a family physician based in Alabama. She runs a clinic there at the hospital where she was actually born. How cool is that? And she is the mother to one Langston Miles, who we all know and love in the virtual community. So Dr. Congress, go ahead and give everybody a shout out, and then we can go ahead and get started. I'm so excited that you're here. I just can't stand it.
You are a mess. I'm so completely honored that you have asked me to come on and talk. Can you hear me okay?
Can you guys hear Dr. Congress? Go ahead, Dr. Congress. I'm going to see.
Okay, good deal. Hey, thanks everybody for tuning in. I'm so excited about this and so excited to have been asked to share my perspective on this this life that I've been blessed with. It's not one of those things that you expected. You need mine down some. Hold on. I don't know. My tripod is doing its own thing. That may or may not work. Hold on.
You look good from where I can see the hair, the necklace.
Is that better?
Yeah.
Is that better?
You look great.
Okay. Okay. So, but yes, wonderful to meet you, Gabrielle. So it's been one of those things you can't prepare yourself for, but I'm so incredibly grateful that we have gotten to this point, and for every step of this journey, there's been a reason for every bit of it.
Okay, yay. So, one of the things I wanted to kick off with you guys tonight, and go ahead and put your questions in the comments as we go. We'll circle back and get them. Remember, Dr. Congress and I are doing a 3-part series. So, this is part one. Part one is just welcome to the NICU, the beginning, finding out about a baby coming to the NICU in those first few days. And then we're going to do a middle segment about life in the NICU. And then what I'm really looking forward to is life after the NICU, because I don't really know a lot about that, and she does. So, okay, so for me, the hardest thing I have to do is when I meet a family who's finding out they're having a premature baby. I'm meeting somebody who is not excited to meet me, and I'm usually saying something that they don't want to hear, and they pretty much want me to get out their face. And so that's the first thing I want to talk to Dr. Congress about, was about her the moments during her pregnancy that she found out there may be a complication, and then when she found out that she was in fact having a premature baby.
Okay. Our story was a little bit different in that my pregnancy was wonderful. Everything was going great until it wasn't. I mean, it was just very, very sudden. I was fine. I had gone to work the previous day, and then in the middle of the night, when I woke up, I had to have a bowl of chicken and rice soup between 2 and 4 every morning. It was the craziest thing that my child was demanding, and still is, and he would demand his chicken and rice soup and would not let me sleep without it. And I got up as usual, around that time. It was about 4, and that's when I found that something was wrong. And it was just very, very sudden. I didn't feel anything. Nothing was different. It was a regular day. And all of a sudden my world turned upside down, and I was like, what in the world? It was so shocking. And I can remember I was talking to someone about this the other day, because so much of that day is fuzzy to me, even still,
Yeah.
2.5 years later, that I don't remember a lot of the details, and I don't remember the nurses who were involved and people who were there. And, it's just so many things that were empty. But for us, I went in to see my OB because I was having some bleeding, and I was terrified. And he had me to come in through the back door, as usual. I go in through the back door.
Right,
They're
right.
just 2 floors up from where I practice. And I remember him saying, at first I saw his face and I knew something was wrong. And he said, a bulging bag of water. And after that, everything just kind of it's like the room went gray. I don't know. It's hard to put into words how that went. And so at that point, I was 22 weeks, 6 days.
Wow.
And it being 22 weeks, 6 days, I mean, I knew what that meant. I knew what that meant. No one had to explain to me what was going on at that time. And that's the blessing and the curse of being a physician in situations like that. And I remember everybody around me was moving so fast. Everything was going, and I was just there. And I was
Yeah.
just sitting there. And I figured, it's time to call Langston's dad. It's time to call my parents. And so I did those things, and I just sat. I was just there. And people were doing things around me, and they were running. And I remember getting my injection, getting my shot for my steroid. And everything just, I don't know what happened. I can remember bits and pieces. I remember my OB, Dr. Richard Stevens, he said, I remember hearing him say, I want her there yesterday. And I don't know who he was talking to. I'm guessing he was talking to the receiving hospital because I was at my hospital and had to be transferred to UAB downtown. And
Dr. Congress, so is that where the level 3 was? They were going to transfer you to a
they were
level 3?
level 4 to
Level 4.
the
Okay.
RNICU there. So I had to be transferred, and I heard him talking to them and getting my steroid and getting me to L&D, and all this stuff was going on, and I was just there. I just remember just sitting there.
Okay, so Dr. Congress, before you tell us about actually getting to that hospital, you mentioned, she said twice to those of you guys who are listening, she said, I knew what 22 and 6/7 meant. I knew what that meant. So what, can you explain it to our audience who may not know exactly what that means?
Well, I'm not a neonatologist, but I do remember that when I trained, that 22 weekers were not viable.
Yes.
And that was not that long ago.
Yes.
And I'm like, there's nothing to do. If I'm 22 weeks, 6 days, and my bag of water is bulging, what is there to do? And
oh my gosh.
my
Okay,
daddy.
so I'm so glad she said that, and then I'm going to let her go. But I do want to say this, especially for our replay viewers and those of you who may be sharing. She's so correct, and it wasn't that long ago. And even today, there are hospitals where if you go into labor at less than 23 weeks, there will be no resuscitation offered because 90% of those children do not survive. And so it's considered to be futile resuscitative efforts, many die in the delivery room or in the first few days of the NICU. And so she's correct. So for me as a neonatologist, when somebody is 22 and 6, and I'm looking into the eyes of a mother and I'm thinking, well, if we just get to midnight, it's a different conversation. It's just so crazy. So there's so many ethical issues and so many challenges. So when she said, I knew what that meant, I just got chills because we have to talk to so many families who are in that limit of 22 to 23 weeks, who have to make impossible choices, as well as caregivers who have to make impossible choices. Okay, so I'm glad she pointed out she didn't have complications because 50% of women who go into preterm labor, everything was going fine until it was not. And so I was so glad that she clarified that because that's very, very helpful. Okay, so she said everything was moving fast. Gabrielle Jones is on, and she had a micropreemie. She said she remembers that as well. Take it away, Dr. Congress. So now we're headed to the level 4.
I'm there. They're taking me to labor and delivery, and I hadn't had anything to drink because actually I started at 4 o'clock with some bleeding. Okay, I went to the ER, and they took me, of course, to triage, to L&D. They checked me. I sat there for 3 hours. They watched everything. Everything was okay. They thought, I wasn't changing. Baby sounded wonderful on the monitor. I remember his heart rate was at 152, and he was doing just great.
You remember that? You remember the heart rate was 152? Wow.
And I came on back home about 7. I canceled my clinic, and I came back home, and I was like, I'm just going to rest today because I had an appointment later with maternal and fetal medicine. And I just didn't have an appetite. I tried to get, I had gone to get Chick-fil-A, and I didn't eat my Chick-fil-A. So that doesn't really happen. I should have known then. I should have gone back to the hospital because something was terribly wrong. But I couldn't eat, and I didn't want to drink anything. Result, of course, that means I was dehydrated.
Yeah.
And they had the terrible time trying to get a vein, and they're trying to start my mag. So at my hospital, I got my first shot of steroid, they did finally get my mag started, and my parents got there, and they were saying, my dad said, well, what does this mean? What's going on? And I said, well, Dad, I felt so incredibly hopeless. I've never felt more hopeless. I couldn't grasp, there was not anything I could grasp at that point. And I told my dad, I said, they're only doing this because it's me. They're only going through this because there's nothing to do. I'm 22 and 6, and I have a bulging bag of water. And so by the time they got me situated and I'm headed to UAB, University of Alabama at Birmingham, downtown. I'm headed there, and it was the bumpiest ride of my life. I felt like I was on a wagon trail. And I said, good Lord, there's no way my water is not going to break before I get there, because we hit every bump between Bessemer and Birmingham. We hit every bump, all of them. But gratefully, I did not rupture. And when we got there, it was a room, it was probably 25 or 30 people, because they were expecting that I would have delivered en route. So they had the NICU team. Yes, they had the NICU team there. They had all of the OB team. They had the head of OB, Dr. Stephen at Collar Head, and, letting them know I was a colleague, and they were really, there to provide support. And I can't say enough about how well they cared for me and how great of a support system they were. And they were ready. I mean, when we rolled in that room, they had everything ready, warmers on. They were ready.
So Dr. Congress, when you were going en route, you knew that your baby was coming, or were you still hoping you would get another day to be 23?
Kept praying. I just kept praying. I kept praying. Just let me get to UAB was my biggest thing. I'm like, just let me get to UAB, because I really felt in my heart that if I didn't get there, that we had no chance. I'm like, we have to get there. Like, we need to be there and stable, not in the back of this ambulance, none of this, foolishness. And I just kept praying and just to get there. And when I got there and they did the first exam, of course, they were not going to do a digital exam at this point because I was still intact.
Right.
They did the bedside ultrasound, and that is what gave me my first glimmer of hope. The bedside ultrasound discovered that the bag of water had actually fallen through the cervix. I was not completely dilated.
Wow.
So the bag was bulging, but I wasn't complete. So at that point, they're feeling, okay, maybe we can stop the labor.
Keep them in a little longer.
Keep them in, the goal was if we can try to keep them in at 24, and then we'll go to another goal. It was just like, just baby steps. And so of course, they put me on my head. I was in Trendelenburg, and I couldn't see anything, and everything hurt, and I didn't care. I said, I will stay here as long as I have to stay here. I was praying for a long stay, with my feet above my head. I did not mind that at all. I wanted every second I could get. And so
I want to wait, Dr. Congress. Okay, so thank you for those who are joining. Welcome, Donna Ewing, and I saw Dr. Jeffers on. I also saw Michelle Williams. Thank you guys for joining us. Dr. Congress mentioned a couple of things about the care of micropreemies. So many things go into play before the neonatal team ever comes there. And she emphasized she wanted to get to the level 4. She did not want to deliver in the back of the ambulance or en route, with the bumpy road. And we have great data to show that when you are having a micropreemie, or when you have an extremely premature infant, you need to deliver in a tertiary care level 3, level 4 center where the NICU team is there. You need to be delivered somewhere where they are not driving in to be there. And also she mentioned getting her steroids in. So we quoted some numbers that are really dismal, but we do know that for babies that are able to receive steroids, that their outcomes are better, particularly if you can get those 2 doses more than 24 hours before delivery. So thank God we were able to do that. I am flabbergasted that she remembers that the heart rate was 152 when they checked his vitals. And a little, when she said that was her first glimmer of hope when she heard about the bag, where the actual position of the bag was. So I think for me as a neonatologist, all the opportunities to lose hope before you even meet me, I'm hearing it in a new way from Dr. Congress, because they've already had so many levels of news that's not reassuring before you even meet them. Okay, so we're in Trendelenburg and we're upside down.
We are upside down, and we're fine with being upside down. And at this point, my son's father was sick. He was in Atlanta. He lives in Atlanta, and he was there, fever 103, asking me, what do I need to do? And I'm like, don't come near me. You don't get to come here. I don't know what you have, and whatever it is, I can't afford to get sick. I will FaceTime you. And, you know, so
She's
of
still
course
that way.
he's he's worried, and I'm worried, and of course my family is there without question. They are there, just like within minutes. They are there right at my side, and my amazing doula is there. She's on watching. Aisha Pruitt, she is
Oh, awesome.
yes, my soror, my confidant, my doula, my lactation consultant. You know, thank God she was there waiting, you know, giving me massages because I'm upside down and everything hurts. And trying to make me, you know, to feel better, and I was just, it's so much of when you're going through this and you don't know, you get to a point, and I know I did, I can't speak for anyone else, when you don't feel like you have the strength to pray. And it's a blessing to have people around you who are able to kind of pick up that slack for you. KT Johnson, you all know her as KT Johnson. I know her as the little tiny dynamite Dr. Cree. She was there to make sure that I to keep a positive outlook, to pray for me when I couldn't. And of course, you know, my family, my sister-in-law was there, spent the night there with me, to be with me, and I needed that support. I know I could not have made it through without having those layers of support that I had, because I just didn't have it in me.
Right.
I didn't I
So
didn't
Dr.
have it in me.
Congress, did you at the time know anybody who had personally had a micropreemie that had done okay? In your inner circle?
Ironically, not that young, not as young as Langston, but one of my really good friends in residency, while we were residents, had a baby at 25 or 26 weeks. And so I had been there with her through that entire process. And Brooklyn is
Oh,
now,
wow.
she's almost 6, and she's
Uh-huh.
doing great. But you know, I couldn't think about anything. It was just, you know, I was trying to find, it was, I can't put
Just a
into
blur.
words. It
So
is.
so do you remember the first conversation with the neonatologist once they determined that your water was that you had a little more time because of the position of the bag? Do you remember what they said, or is that a blur? Or
I
did they make you
remember
mad?
he said, "Well, Doc," he said, I don't have to tell you what the statistics say." And I said, "No. Um, I know that it's not a great outlook." I said, "But I want you to treat me like any other mom here. Pretend I don't know anything, because right now I
Yeah,
can't think. I can't
yeah.
think, and I need you to be straight with me, and I need you to just be upfront with me." And he told me, he said, "Well, you know, at this point we have about a 10 to 15% chance of him doing well." And I remember I felt sick. I was like, 10 to 15%. I don't like those numbers. I don't like those odds. How do we
Yeah,
not do this? Like, okay, we have to stop this. And I
yeah.
remember thinking, I was like, God, are you serious right now? Like, I was a wreck the whole first trimester. You know, what a lot of people don't know is that I had battled with infertility prior to getting pregnant with Langston. And he was my most beautiful surprise. And I'm like, okay, he has a name. He has a room. I've already ordered his bedding and all of this stuff. And I was just like, this can't happen. Like, I can't lose my baby. It's all I can remember thinking. And I remember Aisha saying, "You're not gonna lose your baby. You're not gonna lose your baby." And I was just like, I can't even, I couldn't let my mind go there. But he
Can you
told
just
me
say that again, Dr. Congress? He has a name and a room. Oh my God, that was so, I mean, that's powerful.
that was what it was. I was just like, he has, I mean, this is my baby. I talk to him every night. I sing to him. Um, we have dreams for him. We have talked about who we um have dreamed for him to be, you know, imagine him to be, and all of these things. And I kept thinking, no, this can't happen. It just, it can't.
And I
And they were
see,
telling me, you know, the longer we can hold off, the better. You know, every
yeah.
minute counts.
And I see
That's all.
Gabrielle Jones is agreeing with you. She had a micropreemie as well. And I think um, when we're talking to families as the neonatologists about their chances and what we're trying to do in the ICU nursery, we often are imagining the worst case scenario
Absolutely.
because we're trying to prepare families, but I don't think we always consider that this baby has a name and a place and expectations and
Yes.
a very wanted person who we want to be here. I mean, a
Yes.
name and a room. I'm going to remember that the next time I have to go and talk to someone about
Mm-hmm.
numbers.
Mm-hmm.
Because the baby has a name and a room. Oh my gosh.
Yes.
Okay, so how long did we how many more days did we get, Dr. Congress?
We made it, this started at 22 and 6. We made it
Yes.
to 23 and 3. So 4 days.
Woo!
4 days. So
You guys,
I was
if you're
very excited.
listening, y'all don't know how big those extra days are. Those
Yeah.
extra days are, I mean, it may not sound like a lot, but it changes your percentage for survivals by as much as 10 to 20%, especially if you get steroids.
Mm-hmm.
Yes, KT, Dr. Johnson mentioned, Dr. Cree mentioned asking what their baby's name is. So I always ask the name of the child when I'm meeting families for the first time. I even talk to the baby in the womb and say, hey, like if I had met Langston, I've been like, hey, Langston, this is Dr. Terry. You don't want to meet me today. And so
No.
their name. Okay, so those extra days are huge. And she was able to get the steroids in. And I love how
Yes.
she highlighted having her support system, having her prayer partners, her parents, the
Mm-hmm.
father, even though he had a fever, and her doula, because that does make a difference. It really does make a
Yes.
difference.
I,
Okay, so
I,
tell us
I
about
agree.
that day.
So the day he was born, it was everything. It happened so crazy. That morning I felt pressure, but I felt like the pressure was from the catheter. Is what I was thinking. And
Catheter,
so
yeah.
I had my friend Leandra. I don't think Leandra's watching. She stayed with me the night before, and everything felt great. I felt fine. I had sent everyone home. I sent Leandra to church. I talked to my dad, sent him
Because
on to
you're
church.
feeling good by now.
I feel good. I feel good. And they're thinking about moving me from L&D to
To the floor.
antepartum, to high
Okay.
risk for the
Oh, that's
long run.
cool.
We're there for the long haul.
Hey, Brittany, thanks for joining.
Hi. So
Hey, Chris.
I okay, so that morning is Sunday morning, and I figured, I know I'm going to have visitors today. So I asked them, I said, can you come in and help me get a bath? I'm sure my family will be coming by, my aunts and cousins and everything. And so they said, oh, yeah. So I'm getting my bath. I'm okay. We're talking about her kid. She had a child in the band, and we're talking about her teenager. And she finished my bath, and all of a sudden, I felt pressure and I felt hot all over. And I was like, goodness, what in the world is burning up?
Were you still in the bed or you were actually getting your bath?
I was in the bed. I was in the
Okay.
bed. They had to do it. I was only allowed up to go to the bathroom, and that was after day 3.
Okay.
Uh-huh. They let me go to the bathroom. So I'm laying there and I'm like, I'm just hot. I can't, I'm burning up. I'm burning up. I'm burning up. So she's fanning me. And at this point, I'm throwing covers off, and I felt like I was on fire. And I'm like, I need something. I need a fan. At this point, I'm not proud of myself for about the next 30 minutes. I'm not real proud of myself. I was not a good patient.
Not a good
I was
patient.
I was burning up, and I'm like, I need a fan. I don't know.
We forgive you.
They went and got me a fan that clipped to the bed, and I had the fan just blowing on my face, and and then I got nauseated, and I'm like, something is wrong. So I literally went from having a conversation with my friend Faith was going to visit me, and I was like, okay, just let me know before you come, to 10 minutes saying, 10 minutes later, I texted her and was like, not a good day.
Wow.
I felt terrible. And then I got nauseated, and I said, something's wrong. So I text my sister-in-law and I said, I'm in a lot of pain. I just started hurting so bad. And my sister-in-law said, I texted her, I said, I'm hurt, I'm in a lot of pain. She said, I'm on my way. And they were at church. And she left my mom and thought about, oh, I should have told my mom. So she turned around and got my mom, and they headed there. Now, to give you a timeline for me texting her, she was in Hueytown, and it's about a 20-minute drive from Hueytown to the hospital. She left immediately. She did not make the birth. Like,
Wow.
he was born and in the NICU when they got there.
Oh my gosh.
It was that quick. I mean, in 30 minutes, in a 30-minute time frame, it was 30 minutes between me telling her my friend she could visit, and me having a baby.
Wow.
It
So
was,
did so he did so you delivered vaginally?
I did.
Wow.
I did not rupture until the bag hit the bed.
Wow.
Yeah.
And so for those of you who are just joining, thanks so much for joining. Go ahead and share. Welcome to our replay viewers. We're here with Dr. Alisha Congress. She's a family physician in Alabama. She is very active with Martyrdom, as I am, but she is the mother to a 23-week Micropreemie who is 2.5 now, who we all know and love. His name is Langston, and he's our virtual prince. We love him. I can't wait. I feel like I know him already, even though I haven't met him in person. And so she's going through her journey from an uncomplicated pregnancy to finding out that she was in preterm labor with a bulging bag of water at 22 and 6/7 days. And many hospitals will not even offer anything at 22 weeks. And her journey from the 22 and 6/7 to the 23 and 3 or 4, Dr. Congress?
23
days when Langston actually delivered. So go ahead and make sure you circle back to the beginning, because she shares a lot about what it's like to be in that position, being numb, feeling hopeless, and not remembering a lot. But one thing that has really resonated with me as she's talked is when the doctors were talking, even though she's a doctor and she knew all this information, hearing this information and thinking this child has a room and a name, and I've ordered bedding, and these numbers, what you're trying to say is not, we need a different plan. And so, that was really helpful for me, because I have to deliver a lot of bad news, and I don't think I've ever heard a mother explain it that way. So thank you for you guys that are on who's sharing. Thank you for our replay viewers. Dr. Congress is going to tell us now about what it was like to meet Mr. Langston.
Langston, so I will circle back just briefly in that I went into labor on Friday. He was born on Sunday. I went into labor on Friday. They were able to stop it. So I had gotten an epidural on Friday. Well, they turned it off because labor stopped. Well, then everything started back so quickly that there was no time to get the anesthesiologist to turn it back up. So then I ended up having him naturally, which was something I said I would never, ever, ever do. So I was like, God, you're so funny. Thank you.
I didn't know that. Oh my gosh.
Yes. So I've always said that if I have another child, that I want my epidural the day I get pregnant, like the day I find out I'm pregnant. Go ahead and give it to me, because I cannot do.
Yes, epidurals the day of pregnancy.
Get it right there.
This story is amazing, isn't it? I'm so happy that she's blessing us with this story.
But when he was, so we fast forward back to Sunday, and he was born, and I remember him. I remember the pressure, the release of pressure, and that's how I knew he was out. And I remember apologizing to him, and I said, "I'm so sorry, Langston. I tried so hard because I felt defeated. I did. I felt like my job was to keep you safe and to keep you here and to hold you in until it was over. And I didn't do that. And I did. I felt a certain amount of guilt, and I felt inadequate. It's just so many emotions at the time. And then I heard this little squeak, and it was just this little tiny squeak. And I was like, what in the world? It sounded like just like a little mouse. And the nurse ran over to me. The nurse was over checking on. She was my nurse, but she's over there with Langston. And she ran back over. She goes, Dr. Congress, he's kicking like crazy. I said, is he? And I'm trying to see him. And I'm like, oh my gosh. And then they said, listen to him. He's trying to cry. And I said, is that what that noise is? Because it was so tiny.
Yes.
It was like a little squeak. That's all he could get out. And they were like, this one is feisty. And nobody was there with me at that point, because I sent everybody home, because I was fine. And I remember getting my phone, because I was not going to miss this. And I'm laying in bed trying to deliver the placenta, taking pictures from across the room. I'm taking pictures of Langston. I'm zooming in. All the pictures that you have of Langston's birth, I took them.
Oh my God, are you
I took
serious?
them
They're
myself.
pretty
Yes,
good.
I took them myself. Because I didn't know how long I had him. I
Yes.
didn't, and I was like, I have to have this. I have to have this moment. I can't lose this moment. And I was taking pictures, and they were like, he's something else, and they did not have to immediately intubate him. He was breathing
Oh
on
my
his
gosh.
own.
So let me just, I want to say something. So a couple of things. She mentioned she apologized to him. And I'm so glad that she said that, because that's a feeling a lot of moms of preemies have, that they failed their baby. They're not always able to voice it, but later in the NICU, they will have a lot of questions about, is it something I did? Could I have done something different? And I'm so glad that she voiced that, because really, you did a great job. You got them to 23 and 4. I mean, you did fantastic. But I think a lot of moms struggle with that, and I think
Mm-hmm.
you expressed it so eloquently. And as a neonatologist, we love feisty. We love hearing that little squeak or the mouse
Yeah,
sound, or I mean, it's amazing. And parents are always amazed. I tell parents all the time, look, I've 22 and 23-week babies do cry. Like, you may not have heard it because we put the breathing tube in, but I've
yeah,
heard them cry. I have heard them
yeah.
cry.
That
Oh
was
my
the first
gosh.
time
I can't
I
believe
got
you
to
took
hear
those
it.
pictures.
I did. Took every one of them. Every picture
Wow.
that was taken of him on the warmer, the pictures of him taken in the little isolate when they were
Yes.
rolling him to the NICU. I
Yes.
asked her, I said, can you bring him to me? And she rolled him over to me, and she held him up. She held
Hey,
his little
Dr.
head,
Jackson.
like when he could, held him up where she could see me. And I
Wow.
took his picture. Um, and he was
And you
not
guys, did
intubated.
y'all catch that Dr. Congress said she wanted to get those pictures because she didn't know how long she would have, or he would have. Did you guys catch that? And I think
Mhm.
that's a very real fear that parents of micropreemies have. How long am I gonna have? I got
Mhm.
here, I got to hear his voice, but once you take him, am I gonna see him again? Which is
Yeah,
why it's so important to be able to go back and give updates and make sure we capture some pictures as well. Oh my God, I didn't know you took those pictures, girl.
I did. I remember thinking, I'm like, I don't know what's happening here. Hey, Dr. Sam. I didn't know what was happening. I didn't know what was next. I didn't know anybody who had had a 23 weeker, and I didn't know what to expect, and there was so much
Wow.
going on. And one of the things that I tell moms, as I've been working with NICU moms over the past 2.5 years now, since Langston was born, is to take pictures. I know that it's difficult to see your baby like that. It's difficult to see the wires and the tubes and seeing them so fragile. But you have to record those memories. It's part of their story. It's part of their testimony. And for me, I just remember thinking, I don't know what's next. But
Yeah.
whatever I can have, I have to have it. I had to have it. Um,
And
and,
I
and,
think
and
Dr. Congress, were you had anybody explain to you about what his skin may look like at 23 weeks, or seeing the little rib cages or the breathing?
I don't remember if
Hey, Dr. Jackson. Hey, Dr. Inga.
I don't remember that part. I don't remember that conversation, but I do remember that I had never when I saw him. So it took a while. Like after that, I saw him immediately, and then they took him to the NICU, of course. And they did warn me that he's breathing on his own now. He's doing great. We will likely have to intubate him because he'll tire out. He's young. I'm like, oh, absolutely. I understand that. She said, so don't get alarmed if that when that happens, because we want
Right.
you to expect that. Like absolutely.
And how big
Well,
was he? I
one
forgot.
pound, 7 ounces.
1 pound, 7 ounces.
Mm-hmm.
1 pound,
12 and a
seven
half
ounces, you
inches.
guys, breathing on his own, 23 weeks when he left the delivery room.
Yep. 12 and a half inches long. And I was so proud of him. Like that's why I tell people all the time, he is my greatest achievement. He is. I was so proud of him because I was amazed at how much tenacity he had and this little bitty little thing. And I only got to see him briefly.
Yeah.
And they took him away. And then I had to go, then to prolong it, I had to go for a DNC,
Yeah.
plain placenta. And I'm like, oh my God, I just want to get to my baby. And when I finally, they rolled me into his little room and I saw him. And the first thing I saw was his feet. They had him in the little thing, and I saw his feet, and I was like, those are his daddy's feet. Are you kidding me?
His daddy's feet.
Those are his daddy's feet. They literally were about the size of like a joint of my finger, but they were his. And I was just like, really? And I looked at him and I counted his little toes. I counted his little tiny toes, and I looked at his hands, they were also his daddy's hands, and I was just like, this is crazy. This is crazy.
And he got his daddy's face too.
He's getting, yes, all of the above. But I was like, really? 4 days upside down. Trendelenburg.
And that's what we're doing.
Okay, this is what we're doing. That's fine. So
you guys, I want to just emphasize how she, her perspective as a parent, being able to find those moments of joy and connection with her baby. And she's right with respect to taking the pictures. I know our NICU nurses work really hard to make sure parents are able to bond. But when you first get to the NICU, the babies that are 22, 23 weeks, they don't always look like a baby. And their skin can be very shiny, translucent. You can see their little rib cage. Yes,
he was red. I mean, red. I had never seen. I was like, what is going? And then, but then like some of my biology was coming back. I'm like, oh, he didn't have a fat layer yet. Like, it's just I'm looking at.
You're looking for the fat. You can see that little rib cage, but it's so important, like she said, to touch those fingers and toes, and the nurses will help you do that. But it can be scary at first. So what about those first few days, Dr. Congress?
So that day, of course, I didn't stay down there long because they're having to get me admitted to my room upstairs and all of that. And I remember, my family showed up like right after. So
after you had already been to the NICU or after the delivery?
After the delivery. So my cousins, my aunt, they poured in there like crazy, and they actually went and spent time with him as they were admitting him into the NICU, while I was in recovery from the DNC. So they had all seen him, and they're like, oh my God, we saw him. And then, everybody's, I'm like, well, when do I get to see him? I saw him, but I need to see him.
Yes.
And we got to my room, and like I said, Aisha was there, who was my doula, my lactation consultant, and I was talking with her, and I said, look, when do I pump? She said, now, if you want to. I'm like, let's go. He needs this milk. My boy needs this colostrum right now. And she's like, let's go. So we got the nurse to bring our pump in, and she helped me get hooked up. And I'm like, oh, good. What am I doing? This is so awkward. I've never hooked up to one of these things. And like within minutes, here comes the liquid gold. I was like, what?
So you did have some colostrum.
I did. Matter of fact, let me see.
And I think that's a lot of moms or preemies are surprised that they do have breast milk. And for the moms that are on it, for those of you who are remembering your journey, and for those of you who have friends who may have micropreemies, we don't consider breast milk a medicine, and we don't consider it a choice or food. We consider it medicine. It is the single most important thing we can do for our babies. And obviously, every mom's not going to be able to pump or have milk, and we do have donor breast milk for our micropreemies. But you absolutely do have breast milk, even if you have a baby at 22, 23 weeks. You have it.
And I was like, we got to go to the nursery. Let's go. We got to take it down there too. And they said, yeah, he could have it. I called to see. They said he could have it. So when you first feed him, he's so tiny, they actually use a long Q-tip, and they're just swabbing his mouth with it because that's all he could have. And I was like, oh, well, he's got plenty. We're good. I'm good. And I was trying to see. I don't know. You can't really see this well, but that's him getting his first milk. That's the little Q-tip.
Oh my gosh. We gotta put that up on the we gotta put it in the comments after.
I'll put it in there. Okay. That was him getting his first little swab of milk, and
that was in the first day?
8 hours. He was like 8 hours old.
Wow.
Not 8 hours.
Okay, so that's a miracle. We love that hospital.
They were amazing. They were like, come on, let's do it. What do you want? Let's say, if you want to bring it, yes. And they would awesome. Come. They were so supportive of whatever I needed to do. And she said, come on, you can feed it to him. And I was able, she said, no, he's your baby.
Yeah.
And one of the things I tell NICU moms, please try to do everything that you can for your baby. Everything that and I asked him, I said, everything that I am legally allowed to do, I want to do for him. If I
Yes.
can, I want to do, because I needed to be able to bond with him. It's very difficult as a NICU mom to feel like the mother, because
Yes.
you have other people who tell you when you can hold him. They tell, in some NICUs, they tell you when you can visit. I mean, thankfully
Yes.
ours was 24 hours and
24.
we could room
Yes.
in. But in some cases, it's hard to get that feeling of, this is my
I
baby.
am the parent. Yes.
I'm the parent. And it was so important to me in making sure that I could do whatever I was allowed to do it. And they were very, very adamant about allowing me to do what I was comfortable with doing.
And I'm so
Um,
glad Dr. Congress mentioned that. We're gonna, when we talk about life in the NICU, we're gonna try to come up with just the top 10 things that she found helpful in terms of being able to feel like a parent. It is one of my pet peeves that parents have so few choices in the NICU. You know, when you
mhm,
can come, when you can't come, when you can hold them, when you can't hold them, when you can talk,
mhm.
when you can't hold them. So, I mean, and I don't think we see that. And so you're right. And it's interesting you said, what am I legally allowed to do?
Yeah,
Um, because really we do make you feel like it's illegal if you like touch your own child.
it is. I'm like, I mean, can I touch him? Can I? When it was when I could, I'm like, okay, what can I? Okay, I can't administer medications. Got it. Understand. What can I
Right.
do?
Yeah,
Okay,
what can I do?
I
Because
can get
sometimes
them
there are a
to
lot of things you can do, but it's not being offered to you for whatever reason. So
right.
I love it.
So
So what
so that was what I wanted to do. I see my sister-in-law is on. She is a part of my amazing support system. One of
hey
the most
sister-in-law.
phenomenal one of the most phenomenal women I've ever met, and I'm just was so grateful to her throughout the entire process until now. She's actually watching Langston as we
Right
speak.
now. Yay!
She's
I see
downstairs.
Kimberly Ramos mentioned that her husband ran to the NICU every 3 hours to bring breast milk. And I was going to say, yeah, we call the husband the milkman. I usually tell the husbands that when I get the consult or the daddies, this is going to be your job to make sure we get the milk over here. So
Hmm.
Dr. Congress, we're, I think it's 7:45. I think it's almost 8. We've held our audience for a while. I, um,
Yeah.
do you have some thoughts about that first week, something that stuck out that really bothered you, or a painful moment for you, that you'd like to share with our audience?
That first week is rough. You've just undergone a huge ordeal. I mean, you've just brought forth life. So you have to remember that what you've been through, you're exhausted, you're scared, I mean, terrified even.
Yeah.
Uh, you are traumatized. You're confused, and you have so many questions. I mean, it's so many different things that's going through your mind at that time. And I remember I just, I couldn't stay there for long in the beginning,
Mm-hmm.
because every time, he was desatting every second. It seemed like he was desatting. Every time the alarms went off, and I mean, there were so many alarms and beeps. And the thing was, I knew what it all meant. I knew what
Yes.
every number meant on there. I knew what this meant. I knew what that meant. And I was like, I got to get out of here. I can't. I have to just do it in small bursts.
So
Um,
you gave your
and
permission,
that's
you
what,
gave yourself permission to be okay to leave the NICU. I find sometimes
absolutely,
moms have so much guilt about
absolutely.
leaving, and at the time of
You have
discharge.
to take care of yourself. You have to take care of yourself. And for me, the nurses there, I love my UAB Red Pod nurses. They were and still are a blessing to me. Many of them are still keep in touch with Langston right now. They know what is going on with him. They keep up with him, and they would encourage me to, you have to take care of yourself. Have you eaten? you need to get some rest. You haven't been sitting up too long, have you? Those things that you need to, sometimes you need other people to grant you the permission that you're not comfortable in granting yourself. And I think it's so important in having someone that will help you to do that. And I had people, to remind me, hey, you just had a baby. You just had, I remember my sister-in-law saying a couple times, you just had a baby, when I'm thinking I'm superwoman, and trying to do this and trying to do that and run into, I walk down to the NICU and they're going to wheel me down there. I think I'm good. I got about halfway there and was like,
I'm not good.
Not smart. And I have to come back. Okay, so it's in the biggest thing I would say is to extend yourself some grace and to allow yourself to allow yourself to be human, and to deal with those situations and to say, look, you cannot move into the NICU. Don't do it. Don't do it.
Don't do it. And do you remember, Dr. Congress, before thanks for sharing, Latoya Carlisle. She was agreeing with you about being traumatized.
Oh, absolutely. Yes, that's a soror and fellow NICU mom, preemie mom. Yes, absolutely.
Hey, Alice. So,
hey, Alice.
What was I gonna? Do you have is there anything from the medical staff? Sounds like you had a great team there. You gave the Red Pod nurses a shout out. Were there any interactions the first week with the neos or the nurses that could have gone differently, or you've been pretty happy with that?
I was very blessed. I really was.
Yeah, sounds like
one of the biggest things I could say about the neonatology team and the residents is that they respected me as his mom, and they respected me as a colleague, and that was very, very helpful to me.
Yes.
Because as a physician, we fix things. That's what we do, and so it's very disheartening when you can't fix your own child. And they respected that, and they allowed me to have input and to I was just so grateful for that. And all of the time that things were going on, that they would, if I felt like there was something going on, and we'll talk about that when we talk about life in the NICU, that mother's intuition, they didn't hesitate to say, hey, you know him better than anybody on this planet, and I'm grateful for that.
Oh my God, I love that. Yes. Oh my God, we could do a whole day on mother's intuition in the NICU. So you guys, before we wrap up, and we'll circle back in case we miss any questions, I want to just, for those of you who are meeting Dr. Congress for the first time, I don't know if you guys can see, this is her book, Miracles and Milestones from the Heart of Langston's Mommy, by Alisha Congress. And we can put in the comments her website if you want to purchase, but you can also get it from Amazon. She has beautiful pictures in here, which now I'm realizing she took from the bed after she just had them. And she talks about her journey in more depth. And so if you want to know more, definitely go to her website that was started in honor of Langston, Miracles and Milestones, and make sure you get her book. And don't forget my book too, Early Arrival, 9 Things Parents Need to Know About Life in the NICU. And chapter 1 is Welcome to the NICU. So this has been Super Soul Sunday. For those of you who are just joining us, you gotta go back to the beginning to hear Dr. Congress's story of her miracle little boy, Langston Miles. And she starts from the very beginning, talking about her pregnancy, which was not complicated until Langston decided he was coming, finding out that he was coming, being able to get a few more days, the fear that paralyzes parents then, and then those first few moments seeing him and hearing his little voice. And I have chills, and I know I've been blessed, and I'm sure all of our listeners have been blessed as well. Thank you to our replay viewers. We hope you guys are blessed. Part 2 of our series is going to be Life in the NICU. I'm going to really get down to the parent perspective with respect to how to bond with your baby in the NICU and some of the things that maybe we, as NICU providers, I know myself, can do better. And then we're going to end with Life in the NICU right before Christmas. So, Dr. Congress, you want to say anything to our viewers before you go? Thank you for spending part of your Sunday with me. It's later there, huh? It's only 8 here, but what time is it there?
No, it's the same time. We're
okay, I don't know my time zones. Okay,
We're both central. Just thank you all for tuning in and for listening to our story. And so many of you have been a huge part of a support system for me, and I'm very, very grateful. I don't think I could ever say thank you enough. This has definitely been a joint, a village effort in this journey in raising Langston Miles. So I'm grateful, and just if there's anything that I can do to help a NICU mom that a NICU mom, dad, family that I would be more than honored to do that.
Yay! I thought we were gonna get an appearance from Langston. Tell him we said. Okay, maybe for the last segment. Maybe for Life After NICU.
Yes, we will allow him to do a very brief cameo. That very brief, very brief.
Okay. All right. Thank you so much, Dr. Congress. I really enjoyed this. Thank you guys to our viewers. We'll see you guys next time for Super Soul Sunday with Dr. Thompson. Congress will be moderating, and I'll be answering some questions from her. All right. Thank you, guys.
Bye.
All right. Bye-bye.